Good day, I'm Dr. Ebony Lambito Alisa de Vesa, and I will be sharing with you the importance of your health. So, we really want to live our lives with value and to live it happily until we die. I mean, if we want to live or not suffer during the last few years of our lives, it is really important that we know that our health is utmost priority. Okay, do you believe that? Do you know that if we value our lives, we will do everything in order to make our life more happy, more healthy, and more full of value compared to those who are actually doing things that can harm their health. So, I am discussing with you the importance of alcohol use disorder and the symptoms of alcohol withdrawal syndrome, as well as our management in the hospital. Yesterday, I'm not wearing my uniform because I'm not on duty, and I'm here to share with you, to share with you my time in order for you to know that our health is our wealth. It's actually okay to drink alcoholic beverages in moderation because there are times that, especially during gatherings, our friends, our family members would actually ask us to join them, to drink with them, and to enjoy the party with them, okay? But there are actually limitations. So you would know actually if this is the right amount of alcoholic beverages, or if you are already having the excessive, intake of excessive amount of alcoholic drinks. So these are actually the basis for this. So what are the standard drink, and how many is okay and how many is too much? So you will know if you already developed alcohol use disorder, if you have already difficulties in decreasing the amount every time you drink alcoholic beverages. And for example, for those who wanted to sleep well, in order to who drinks alcoholic beverages in order to sleep well, then these are actually the criteria for alcohol use disorder. So there is actually what we call dietary guidelines for alcoholic drinking. So for moderate drinking, it's up to 1 drink per day for women and up to 2 drinks per day for men. So a standard drink contains 14 grams of pure alcohol. And remember, in 1 ounce, there is 30 ml. So in a beer, 5% alcohol, 12 ounce, malt liquor, 7% alcohol, 8.5 ounce, table wine, which is 12% alcohol, yes, 5 ounce, others like brandy, 40% alcohol, 1.5 ounce, and lastly, for the spirit, 40% alcohol. So these are actually the standard drink for alcohol drinking. Because there are actually studies that 100 grams per week of alcohol actually increases the risk of death, and that means it's 7 standard drinks per week. Okay, so 7 standard drinks per week is actually detrimental to our health. We also have what we call unit of alcohol, and it looks like this. Okay, standard cider, 218 ml. For standard wine, 76 ml. 25 ml for standard whiskey. Standard beer, which is 250 ml. And alcopop, which is 250 ml as well. So remember, you shouldn't actually regularly exceed 14 units per week. Okay? Don't exceed 14 units per week to avoid detrimental effect of alcohol in our body, and just in moderation. To be exact, just a standard of drink of less than 7 standards of drink per week. Okay, less than 100 grams per week. Okay, to avoid any detrimental effect. I don't want you to experience alcohol withdrawal. That's why I want to let you be informed that alcohol use in excessive amount is actually detrimental or harmful to our health. So, for example, if you have a family member who is actually drinking alcohol every day, you think it's okay because si papa or si mama or yung ate ko, yung kuya ko, it's okay because it's just a few amount or in moderation. But what if that person is already dependent on that substance? You will know that you already have alcohol use disorder if you have this criteria fulfilled, no? Like, taking a larger amount over a long period of time. So, if before, usually, 1 beer lang, ngayon nagto 2 beer, 3 beer ka na, 4 beer ka na, and then, yon nahirapan ka i-decrease siya, no? And then, second is, yung desire mo, yung kagustuhan mo na i-control or i-cut down, nahirapan ka na. No? Yung effort mo, nahirapan ka na mag-stop. And then, a great deal of time is spent in activities necessary to obtain alcohol. Yung naghahanap na yung katawan mo ng alcohol, tapos, naubos na yung oras mo dahil kailangan mo talagang bumili, okay? Like ngayong lockdown or during sa quarantine or gano'n, naghahanap ka ng alcohol. Yun yung number 4, no? Nag-crave ka na, yung desires mo, sumusobra na, okay? Number 5, recurrent alcohol use resulting in a failure to fulfill major obligations. So, naapekto na yung work, yung school, or yung home relationship, yon. Yung sige ka lang ng sige, na inom ka lang ng inom, kahit naapektuhan na yung relationship mo sa ibang tao, may problems na, yun yung effect ng alcohol. Okay, yung 7, yung mga important na mga social, occupational, or recreational activities, yung gini-give up mo na, hindi pinapabayaan mo na yung mga gatherings mo kasi you have to drink. Okay? Number 8 is recurrent alcohol use in situations in which physically hazardous. So, alam mo na may sakit ka or may dinaramdam ka na sumasakit yung tiyan mo, pero sige lang, inom lang ng inom. Okay? Yun, 8 dependence na yan, ha? Okay, alcohol use is continued despite knowledge of having persistent or recurrent physical or psychological problems. So, kahit na alam mo na may problem na talaga, physically, psychologically, yun, ganun pa rin. Continue ka pa rin na umiinom. And then, tolerance, as defined by the following, no? A need for markedly increased amounts of alcohol. If before, okay na yung pakiramdam mo sa 1 beer lang, ngayon, kailangan mo ng 2 beer para kumalma ka or para makatulog ka, yon. Or markedly diminished effect with continued use, yun. Okay, withdrawal or taking alcohol to relieve withdrawal symptoms. So, mamaya i-explain ko yung mga withdrawal symptoms. So, that person can actually develop withdrawal symptoms, signs and symptoms that is actually harmful to our health. So, during alcohol withdrawal, these are the symptoms that are signs that the person will experience during the alcohol withdrawal. We actually have Clinical Institute for Withdrawal of Alcohol scale. So, in this, the assessment of monitoring withdrawal symptoms is actually requested. So, there is actually 5 minutes needed to administer this assessment tool. And the maximum score is 67 for those who have minimal alcohol withdrawal, which is less than 10. So, we have symptoms for withdrawal. So, first is if we know, we take the vital signs, increase yung heart rate and yung blood pressure. That means yung alta presyon, tapos yung pulso mo, increased siya. Tapos yung nausea and vomiting, nasusuka or gustong magsuka nung pasyente, or tremors, no? Makita mo sa kamay niya na parang, parang kinakabahan, parang ganon. Tapos, ang paroxysmal sweats, no? Grabe yung yung sweating ng pasyente na babasa pati yung yung damit, parang naligo. So, ganoon. Other than that is anxiety, kinakabahan, nanenervyos, agitation, parang hindi mapakali. Gustong maglakad, gustong tumayo, kahit kinakausap mo siya, hindi siya mapakali. Tapos, parang ninenervyos, makikita mo ninenervyos talaga siya. So, yun yung isa sa mga simptomas ng withdrawal. So, makikita mo yun sa pasyente na susuka, nervyos, hindi mapakali. Tapos, tactile disturbance, yung akala nila parang may itching, no? Makate, yung needle prick na sensation, burning, or pwede naman akala nila may langgam, or may langgam, spiders, or parang ganun, umaakyat sa kanang kamay or sa balikat. Auditory hallucinations, may maririnig silang mga boses, no, marinig nila na wala namang tao, or basta makakarinig sila. Visual disturbances is yung light parang sobrang bright siya, yung color different, or masakit sa mata. Yun sa visual disturbances. Pwede naman yung sa disturbance is may makikita sila na wala namang tao, na hindi mo naman nakikita. Sumasakit yung ulo, headache, fullness in head, no? Pwede namang yung dizzy, nahihilo, yun yung feeling ng mga tao na nagwi-withdrawal. So, headache, fullness in head. Ito yung scoring ha, nakita yung scoring namin sa withdrawal. And then lastly is the orientation. Hindi nila alam kung nasan sila, sino kasama nila, sino sila. Yung disoriented talaga, or yung clouding of sensorium. So, pag ganito, pag mataas talaga yung score, nagbibigay kami ng benzodiazepines, like most likely diazepam, no? Yung binibigay namin sa pasyente. Usually IV through intravenous, no? Na way. If nagsusuka, especially na, para pag mild, usually tablet lang naman binibigay namin. Tapos, yung mga vitamin B, kasi thiamine is nagdi-decrease sa patient na may withdrawal. So, vitamin B, pwedeng tablet, tapos may injection. Know someone who experiencing alcohol use disorder and alcohol withdrawal syndrome, let them be treated, detoxified. And for those who are chronic alcoholic and they are actually being violent or causes harm to others, we actually advocate for them to be treated, detoxified. And if there is difficulty for that person to stop taking alcoholic beverages, then it's better for them to have rehabilitation. So you can actually comment or ask for informations if this video could be an eye opener to you and be of help to you, or you have concerns regarding alcohol. Okay, don't wait for you to suffer those signs and symptoms of alcohol withdrawal and experience those chronic diseases that can actually be irreversible, very irreversible already to your health. Like for example, there are patients actually in the hospital that are experiencing withdrawal, and there are actually liver diseases already developed due to alcohol use. There are different kind of disorder like alcoholic liver disease. Others experiences varicosities in the esophagus, and there is esophageal viruses, there is pulmonary portal hypertension, and there are bleeding. So there are a lot of people who think that alcohol is okay, but actually if it's too much, it's it's like you're killing yourself slowly but surely. So we don't want that to happen to you or your family. So I hope you can share this information to them and let them know that alcohol use is already happening alcohol use disorder can happen, and it can affect any family members. So if you learn from this video and you want to share this with your family, please do so in order for us to um, be more healthy, not only physically but mentally. So we will promote mental health, and this is actually an advocacy to help those people and reach them. Okay, please share, subscribe, and thank you for watching. God bless.